clean your teeth properly. I think we need to go all the way back, because if as a country we all are not able to clean our teeth properly. Yeah. How are we supposed to clean our teeth?
Okay, so first let's talk about toothpaste and toothbrushes. Okay, so one, toothbrushes have to be soft, not hard. There's no need of a hard toothbrush. In fact, using a hard toothbrush, we tend to damage our teeth. We damage our gums specifically. Okay, so a soft toothbrush with a small head. Okay, now the small head also makes it a bit more difficult to brush, meaning we need to brush more because it does not cover a large surface area. But what the advantage of that is, you can get everywhere. Okay, and that's what we want. Okay, toothpaste wise, any would do. Okay, but the main thing we're looking for is the amount of fluoride. For adults, it has to be 1400 parts per million, the amount of fluoride in toothpaste, and for children under 6, 1000 parts or less. Okay, is what we recommend. Okay, brushing, making sure you get every surface of the tooth, and brushing for more than 2 minutes. That's very important. Okay, and brushing twice a day, morning and before you go to bed. The one you do before you go to bed is far more important than the one you do in the morning.
Okay.
Okay.
All right.
Yeah.
All right. Someone asked me this, and they told me the next time I go have an interview with a dentist, I should ensure I ask this. Yeah. A lot of toothpastes and toothbrushes, we have the tag recommended by dentists worldwide. Yeah. So what you're saying is there's no particular brand that you recommend.
No.
All right. Okay. Yeah. And are these instructions written on this toothpaste, the amount of fluoride, or how do we know what toothpaste has what fluoride?
Yes, it is always, so in the ingredients, it's always written, okay, in the amount of fluoride that it has got, okay. There's some fancy, or rather, marketable toothpaste that contain charcoal and things like that. I wouldn't recommend those, okay. Charcoal does tend to abrade your teeth. It tends to wear your teeth down, and it has no additional benefit in terms of cleaning your teeth. So it can do more harm than good. Yeah.
So what we need to look for in a toothpaste is just a regular brand that has fluoride in it.
Unless you have certain advanced gum disease or you have sensitive teeth, then your dentist would recommend other kinds of toothpaste, some that are made specifically for bleeding gums or for sensitive teeth, but that will be the job of your dentist.
All right.
Yeah.
Okay. We've spoken about brushing. I also ask, especially after meals, you will find us with toothpicks. Some go all the way and store some in the in the hair just to make sure they have, a toothpick for after a meal. Would you recommend the use of toothpicks?
I would not. Okay. There are other methods of cleaning in between your teeth. Now, food does get stuck in our teeth, in everybody's teeth. Okay, and it's irritating, and we need to take that out. I would recommend that you use either flossing or something called interdental brushes. These are basically brushes made specifically for cleaning in between your teeth. They're much more effective, and they don't have the disadvantage that toothpicks have of either one, breaking in your mouth, or two, damaging your gums. Okay, so I would recommend those over toothpicks. That's not to say if you have something stuck in your tooth or teeth rather, and you don't have any other option, using a toothpick once in a while, it's okay. We all do it.
All right.
Yeah.
Okay. All right. You mentioned fluoride, yeah, and the fact that it's important for us to be able to clean our teeth properly, yeah. But isn't this the same fluoride that causes dental fluorosis? That's what you call it, yeah?
Yes. Yeah. Yes. So fluoride is one of those things where, in low doses, is good for your teeth. In high doses, causes, as you mentioned, fluorosis. Okay. Now, fluorosis is mostly caused by fluoride in water. Okay. So high concentrations of fluoride in water, especially when we are children and we have drunk that water, that is what causes fluorosis. So when we are under the age of between 7 or 8 years old, and we drink water in with fluoride that is high concentration, that is what causes fluorosis. Okay. But fluoride is also very beneficial for you, but again in low doses. Okay, the World Health Organization recommends that the amount of fluoride in water should be less than 1.5 milligrams per liter. Okay, but Kenya is also in what is called a fluoride belt. So there are certain geological deposits that are high in fluoride. And therefore, if we use water from boreholes or things like that, the fluoride concentration is high, and that is what is causing fluorosis. Okay, yeah.
And what would parents in these areas do just to ensure that children have, the perfect smile?
That is difficult because it should be the water should be safe. Okay, so we generally drink from what's on the tap, or we boil that water and we drink it. Boiling doesn't get rid of fluoride. Yeah. What parents can do is, it basically should be the job of the local county or the local government to ensure that the water is safe. Okay, particularly the water we use for drinking and for cooking.
For cooking as well, yeah. Because I actually, I have a child, and my son actually has mild fluorosis, and during the whole time raising him, I ensured that I am giving him purified water, yeah, the one that does not have fluorosis in it. But I did not know that even the cooking water actually affects the teeth of children. And maybe you can emphasize on the need to use cooking water that is also purified, not just drinking water.
Yeah. So because boiling gets rid of a lot of things, and it sterilizes water, it kills germs and bacteria and whatnot, but it doesn't get rid of minerals. And fluoride is a mineral, just like sodium and chloride. And,
All right. Okay. So for people who have fluorosis, are they more likely to get cavities?
Mild form, no. Mild form, actually, some studies show that they're actually stronger teeth. They don't look good. They have brown staining, and they don't look good. So aesthetically, it's not very pleasing. But no. But severe form of fluorosis does damage the enamel. So that's the outer surface of the tooth. And that means they're more susceptible for decay. They're more susceptible for sensitivity and, other issues also.
All right, okay. Let's talk about cavities. A lot of people, I don't know, maybe one or two people have experienced toothache. And when I come to the doctor, there's always the option to either extract the tooth. What other procedures are there for people who have already, now we have spoken about how to prevent these cavities from coming in. In the event you actually have these cavities on your tooth, what next for you?
Okay, so depends on the size of the cavity, depends on where the cavity is. Okay, now a tooth basically has three different layers. There's the enamel, there's the outer hard layer, there's the middle layer, dentine, and then there's the pulp. The pulp is where the blood supply and the nervous supply of the tooth is. Okay, so cavities, so decay, that always starts in the enamel. Okay, we'll talk about roots later. Okay, but caries that start in the enamel can be stopped. Okay, you don't need fillings for that. Okay, it can be remineralized. Okay, but by what we have talked about, by cleaning well, by cleaning in between your teeth well, okay, that it can be stopped. Once decay reaches the second layer, you generally need a filling, or once it has caused a hole, okay, it does need a filling. Okay, now if at that moment it's not filled or you're not aware of it, it can be asymptomatic. It can have no pain. Okay, you may experience a bit of sensitivity, but it can have no pain. Once it starts getting closer and closer to the nerve, okay, the pulp that I talked about, then you may start feeling pain. Okay, again, it depends on how big it is and how much of the nerve has been affected. If the nerve has been affected, then to save the tooth, you need to do something called a root canal therapy, okay, which is basically to kill the tooth and fill the pulp chamber where the nerve resides. Okay, sometimes the decay is so big, okay, and it is going below the gums, that the tooth becomes unrestorable, and then it needs to be extracted. So it's all a matter of how big the decay is, where the decay is, okay, how bad the pain is, and so your dentist with you needs to make that decision. An X-ray sometimes needs to be taken in order to show, and also for the dentist to see how deep it is, and from there you can then make a decision whether it's a filling, it's a root canal, or it's an extraction.
All right. Okay. How our jawline is formed, I read somewhere just research before I came on the show that it affects how your teeth grow, and it can cause dental impaction. For example, if your teeth do not grow the way that they're supposed to, which actually affects brushing of teeth and cleaning out. Yeah. And can you avoid dental impaction? Is it possible to straighten out teeth?
No.
So what happens to these?
So dental impaction is basically a teeth that don't erupt straight forward. They erupt on the side, horizontally, or wherever. Okay. We all have, in general, not everybody, but we all have 32 teeth. Okay. The size of the jaw is all different for everybody, okay? So sometimes there's not enough space for a tooth to be able to come out, and they come out in the side. They try and get it, a way to come out. Sometimes they just don't come out. What can affect brushing is something that's called malocclusion, okay? Where your teeth are not in line, okay? They're crowded, one is on top of the other, okay? So what happens is when we brush, okay, we don't get into all the places, okay, and food can get stuck there. That can cause gum disease or decay, okay. Impaction generally involves the wisdom teeth, okay. Again, makes it more difficult to brush. Of course it does, okay. But if you can keep those clean and there's no decay or anything, it's okay to leave them be.
Whereas it's not necessary to extract them.
Yes, but your dentist has to have a look to be able to tell you whether or not they need to come out or not. It should be judged on a case by case.
A lot of times we have seen people with braces. So do they serve a cosmetic function, or do they actually serve a bigger purpose in ensuring dental hygiene?
So they do both, okay? Sometimes, so where your teeth are mismatched is called a malocclusion, okay? They're not straight, they're not, okay? Sometimes it's so bad that your front teeth don't meet, or a certain part of your teeth don't meet, making chewing more difficult. Sometimes you can have something called a traumatic overbite. What it basically means is your teeth actually don't bite on one another, but your teeth bite on the gums. It can be painful, okay? So in those cases, yes, what braces do is they straighten all those things out and making it less painful, making it easier to chew, to eat, okay? Some patients, or some people rather, just don't like the way their teeth look, okay? And they want a better smile, like you mentioned, okay? But it also serves a functional purpose there, okay? The more confident you are, the better you feel, the better your outlook on life, okay? And also straighter teeth are easier to brush, like we've mentioned, okay? You don't need to make sure you get into every nook and cranny. They're straight, so just by brushing, you get every surface of the tooth, okay? And so that leads to lower, gum disease and lower chances of decay. Yeah.
All right. You mentioned a cosmetic function, and I have seen not a lot, just some people trying to put on golds and silver. I don't know what they're called. What do you call those things that people put on their teeth?
So sometimes they can be veneers. That's just the front surface of the tooth. Okay, sometimes it can be a whole crown. Okay, which is basically a cap that is placed around the whole of the tooth. Yeah. So some patients do like that. Okay, placing a gold tooth. Okay. I would advise against drilling a tooth unless it's necessary, okay? Because it's your tooth. If you want to put something on top of it just by sticking on, that's generally okay, provided you can keep it clean, okay? But where you are drilling the tooth out and it's a healthy tooth, okay? And there's no reason medically or rather dentally for it, I would generally advise against it, but some patients like that and it makes them feel better, provided they know the risks, it's okay for them.
All right, and what are the risks associated?
So, drilling a tooth, okay, the more tooth you have, the better it is. Anything we put, okay, whether it be a filling, a crown, it is never going to be as good as what was there naturally, okay? Now, sometimes we have to do it. If you have a hole in a tooth, if your tooth is so badly broken down that it needs a crown, okay, so we have to do it. So we weigh the advantages and disadvantages of it, okay? And make sure that in health-wise for dentally, what we've done at the end of the treatment is better than what you had, okay? Now, if you have a perfectly healthy tooth, okay, and we're putting a veneer on top of it, but a veneer where you have to drill out a part of the tooth, okay, your tooth becomes more susceptible to decay, and that's the main disadvantage of it.
Okay. We are speaking about veneers and cosmetic dentistry, yeah? Cosmetic dentistry, yeah? And a lot of people have told me that they are skeptical about having their wisdom teeth removed, that it's actually a procedure that lasts long. I don't know if it's major surgery, yeah? Like the removal, the extraction of the wisdom teeth. The wisdom teeth, yeah? Is it very different from the other teeth?
Again, depends on the severity of the impaction, okay? Some can be buried all the way down there, okay? And if they're causing issues, and if your dentist determines that they need to be extracted, then it's normally a surgical procedure, okay? So let's compare that to taking out a front tooth, which again needs to be determined if it's necessary, okay? One, access is easier. Secondly, there's rarely a need for bone removal, to drilling out the bone, okay? So yes, it can be very difficult and it can be a long procedure, okay? But again, it depends on the severity of the impaction. Obviously, further down, access is more difficult for the dentist. It's all the way back there, okay? Therefore, taking it out is more challenging. But if you're talking about disimpaction, so removal of impacted teeth, it depends entirely on the severity. The more severe the impaction, the more buried it is essentially, the more difficult the procedure, okay? Sometimes some patients decide that they don't want it done in the local anesthetic in the dentist chair, and they want it done in the operating theatre. Yeah, so that again is a discussion you have with your dentist before proceeding.
All right, okay. Mouthwash.
Yes.
How important is it?
Okay, so if you have a healthy mouth, no gum disease, everything, brushing twice a day plus cleaning in between your teeth once a day is enough. You do not need mouthwash, okay? Sometimes you have gum disease, okay? So you need some supplemental cleaning, okay? So mouthwashes containing something called chlorhexidine have shown to be very useful for patients with gum disease, okay? Sometimes you have decay and you need more fluoride. So your dentist will recommend or prescribe mouthwash containing fluoride for your teeth, okay? But like I said, if you have a healthy mouth, everything is fine. Brushing twice a day, cleaning in between your teeth, and regular visits to the dentist is what you need. You don't need mouthwash. Having said that, there's no harm using it.
Okay.
Yeah.
Okay. How often is regular visits to the dentist?
So generally we recommend 6 monthly visits for both adults and children. But again, it depends on how well you're cleaning your teeth, how many fillings you've got. So it depends on case by case. Sometimes once a year visit for an adult is fine, okay? Sometimes every 18 months. But it all depends on how well you're maintaining good oral hygiene. Children generally, because we want to see their development, particularly development of teeth, eruption and things like that, we generally stick to 6 months. Unless they have severe issues, then we can also bring that down to every 3 months. It's basically your dentist will decide on a case by case basis. Yeah.
All right. Okay. Speaking of children, I have seen when some children are playing and someone accidentally breaks their teeth. Are there remedies for issues like that?
Yes. Okay. So it depends on the age of the child. Okay. So if generally adult teeth start coming out around the age of 6, that's a very average age. Okay. If it's baby teeth that have been broken, okay, we then decide whether or not it's worth saving them. Sometimes we do take them out, okay, because we're more worried about it affecting the permanent tooth, the adult tooth. Okay. If it's an adult tooth that has been broken, then we do everything we can in order to save it. Okay, so yes, we can fill them. If the nerve has been affected, then we need to make sure that if it's dead or dying, then we need to do a root canal. But again, it varies on the age of the child, the severity of break of the tooth. Okay, and yeah, we need to decide.
Yeah, so there's actual remedy. Yeah? People should not stay at home with children.
Yeah. Even if it's a small fracture, okay. So if it's a small break, do go to a dentist. Okay, there could be something. So just by that impact that has broken a small chip that you can see, the root can have been fractured. Okay, so you need to make sure you go to a dentist just for a checkup. Okay, as soon as you can, just to make sure that nothing else is broken in that one tooth. And if it's a baby tooth, so if it's your child is younger and it's a baby tooth that has been broken, sometimes what can happen is that impact can push the tooth in. Okay, and sometimes that can affect or damage the adult tooth, which is developing underneath that tooth. Okay, so you need to go and see a dentist to see whether or not, if they suspect that has happened, then they can order tests, mainly x-rays, and see what's the best way forward.
All right, let's talk tooth sensitivity. What causes it?
So most of the time, what causes tooth sensitivity is exposure of the dentine. Remember, like we talked about the 3 different layers of the tooth. The enamel, that's that outer layer, then there's the dentine. So sometimes that exposure, okay, so when the dentine is exposed, it can lead to sensitivity. Okay, now there are various reasons why dentine is exposed. Decay is one of them. Okay, the other one is gum disease. What gum disease can do, especially advanced gum disease, is cause your gums to recede, to go down. That exposes roots. Roots don't have enamel. They just root dentine. So it's just dentine. That exposure leads to sensitivity. Okay. The other reasons are tooth wear. Okay. So some patients grind their teeth either during the day or during the night, and it can be so severe that over time you grind away the enamel. Okay. That leads to the dentine being exposed. The other reason, the most common reason that I have seen, is overbrushing. These patients who have brushed too hard using a hard toothbrush, again causing the gums to go down, leading to the root being exposed. That's the most common reason I've seen with my patients, at least. So that's why when I initially said what toothbrush to use, always use a soft toothbrush. Yeah.
Right. And is it possible to detect tooth sensitivity before it gets too far?
You'd feel sensitivity.
So there's no way, until my teeth are sensitive, there's no way I would know I am exposing myself to habits that are exposing my dentine.
You personally, it's difficult unless you see yourself, you see your teeth, your gums are going down. Okay, the best way is regular visits to the dentist. Okay, where they will see it very easily.
Okay.
Yeah.
Okay. And are the toothpaste that we're advised to use that claim to help with tooth sensitivity, do they actually help?
Yes, they do.
All right.
Yeah. Okay. Again, your dentist will decide whether you need to use it or not. Sometimes, because these are not prescribed, they're over the counter. It's toothpaste. Okay. So you can, even if you yourself suffer from sensitivity, you can use a sensitive toothpaste. Again, whatever brand you want to go for it, okay? And that will help with sensitivity, provided you're brushing well, brushing gently, and you're using a soft toothbrush. Yeah.
Sorry. Lastly, as you finish, yeah, you mentioned prescription medicine from a dentist, yeah? And one of the things that I know a lot of people will be interested in is painkillers. I have seen some painkillers you actually put on the tooth. I have seen brands that you actually put on the tooth and all. For someone at home, yeah, before they come see a dentist, what is the remedy for toothache?
Okay, generally, so it depends on the severity of the pain, okay? Sometimes the pain can be quite bad and might be a while before you see a dentist for whatever reason, okay? Whether you can't get time off work, whether cost implications, okay? Generally, if you're not allergic to them, simple painkillers, over-the-counter drugs, you know, Panadol, paracetamol, ibuprofen are generally okay. For more stronger ones, see a dentist. Do not just start taking medication on your own, okay? There are no simple remedies for toothache without, you know, a medical professional having a look at you, without a dentist looking at you and seeing what's the best course, okay?